And bonjour. This is Darko and Bruno here on the AI Biostatistics podcast, first one in 2026. Wishing you a wonderful new year. I hope you have high expectations and also good health. Darko, how are you doing, sir?
Doing great, Bruno. Really a pleasure to join you in the first podcast of 2026. And really fantastic to discuss, I think, one of the most important topics in statistics, where there is a lot of controversy, but there is a lot of interesting angles, I think, that we can discuss today.
And we're going to talk about the p-value, so which is the basis of modern statistics. And I like when we dwell into historical elements. And you're going to be the one who teach me about statistics and about p-value in a second. Before we start, there's a technical issue. I think your screen is moving up and down a little bit. There might be a stability issue with your camera. So we might want to check that. Maybe just being careful not to have the camera move. So we in the past we talked about Bayesian versus frequentist, and we said, well, let's make sure we don't lose a Bayesian here. So today, if we talk about p-value, does it mean that our Bayesian friends are going to be left behind and not happy or not interested or etc.?
Yeah, so even though we are discussing a frequentist concept today, we want to say that, we are aware that we have many Bayesian friends out there following the podcast. So we definitely will be covering some Bayesian concepts also in some of the next podcasts. So
Okay.
the p-value, I think, is something that will be the center of this topic, but there are alternatives, the Bayesian alternatives. We will also be comparing them in some of the next podcasts. But for today, let's stick with the p-values, as you said.
We'll stay. Okay. So today, of course, frequentists are front and center. All right. So let me tell you what I think I understand what the p-value is, and you can tell me if I'm correct. It's the non-technical person here, and then we can get into a little bit of who invented the p-value, who discovered the p-value. I hope one of the people involved, the French is French, but we'll see. And Shahir might add historical perspective and maybe some images as well as we speak.
I actually have a deliberate acquisition towards you both today. As our 2026. I think you both are biased towards statisticians. That's what I think. I'm getting that sense of, I don't know. I probably should. Yeah, I should have.
We
said
biased
that.
in favor of biostatistics or against?
It seems like you both are. I don't know. I mean, I'm not super sure about which side to pick yet. I'm not on any side. But with
we bias in favor of frequentists versus Bayesian, or biostat people versus non-biostat people?
I think you were more towards the frequentist side. That's what I meant
yes.
to say.
Well, that's true, right? We cannot lie.
That's not fair, though. You gotta be fair when you're starting. Just speaking on behalf of all the Bayesian audience out there.
All right. Okay, so you can represent the Bayesian side of the. Okay, fair enough.
Add this and see, and I'm hopeful that you might be able to have a proper justification in this episode.
Right. You know what? New Year, new resolution. Let's make sure we hug a Bayesian today, Darko. Let's they need all the love they can get. They find the Bayesian in you. All right. So my understanding what a p-value is the following. So first, if it's more than 0.05, it's not good, meaning it's not significant, meaning there is 5% chance that the result we see is due to chance. 5% chance. Now, by the way, if I'm trying to test a drug, even if there's only 10%, even if there's instead of 95% chance that the drug works, even if it's 80%, maybe I take the drug anyway. So it's a pretty high bar. But what it means, the way I understand it, is that and the threshold is a little bit arbitrarily 0.05. If it's higher than that, it's not statistically significant. If it's lower than that, it's good and it's statistically significant. In this case, statistically significant means that there's less than 5% chance that what we observe is due to luck, as opposed to due to the fact that the drug works. As a lay person describing a biostatistical concept, how did I do?
I think it's actually a very, very good explanation of the reasoning process behind the p-values. So the formal definition of the p-values would kind of relate exactly to what you said. And in the formal definition, there is actually a terminology which goes something like this. I'm just going to paraphrase it for our audience, so to understand easier. So if I see a specific difference, let's say between two groups, I'm using a hypothesis test. Usually the p-values are associated with hypothesis tests. So we want to test a specific hypothesis. Is group A doing better than group B? So if I see a difference between them, I could say, well, how sure I am that this difference is really, the real difference that comes from the real, that would be reproducible in other groups as well, not just the patients or other groups that I'm measuring. And the formal definition goes like this. The p-value is basically the probability that we would see at least as extreme difference. So at least as extreme. So that's also a very important definition. At least as extreme as we are seeing, if we were to repeat the experiment many times. So that's where the frequentist reasoning comes in. If we were to repeat this experiment, we would either see or not see the difference that is at least as extreme as we are seeing in the data. So it kind of has that threshold of 0.05, as you said, which we say, well, we want to have 95% confidence in our results. And that's really, I think, the main term for the p-values, even though it's not part of its formal definition. It really tells you about the confidence you have in your result. So if you have a very low confidence in your result, if we statistically calculate that low confidence, that would be large p-value, right? And if you have a small p-value, like less than 0.05, that's a higher level of confidence. Now, as you said, the threshold is kind of arbitrary. There is a universally accepted threshold for majority of research areas. However, it's very important not to be boxed in by that threshold. That threshold may vary. Sometimes you're not happy with 95. Sometimes you want 99%, right? So it's very important for everyone reasoning about p-values to understand. We have here one of the, well, there is a debate who invented the p-values first. And this was Carl Pearson, who actually played around with the concept similar to the p-values that we have today, actually more than 26 years ago. So in 1900 years. And even though he didn't formally call it the p-values and the frequentist statistical significance, he actually was going for that concept. So he's considered one of the first to actually go into the concept of statistical significance.
He's looking like he's judging us.
Oh, yeah. The Supreme Court judge. Yeah. Okay. Oh, when I realized these Bayesian statistics. Oh. Now, this is, if this comes from Shahir, that means that Shahir is also on our side.
He's a closest Bayesian, I think.
He's he's the Bayesian in disguise, maybe,
The Bayesian in the sky. Yeah. Now this is a good looking guy. This is you want to pull his beard like this and see what happens. This is a good looking guy. Yeah. No, Shahir is good looking too. I understand, but and he's squinting like he's looking like very. Uh,
Yeah,
so he's so this is
people always, sorry to interrupt you, but we always comment on how handsome the Fisher is. And for me, people usually say, like, you are not handsome at all, so you are probably not a frequentist. And I say, no, even
well,
a
that's right.
if you don't have to be handsome to be a frequentist, right?
But it helps certainly. And so this is handsome Fisher, right? Okay.
Yeah.
And so what's his story? Where did he live and and did he had a eureka moment? Did he get the Fields Medal? No, there were no Fields Medal at the time yet. No,
No,
no Fields
no.
Medal. It was before the Fields Medal. Did he get anything? Anything at all for inventing
I'm not
the
sure about the
p-value?
medals, but he is considered as one of the fathers of frequentism, and he's actually the first one, maybe 20 years after Pearson started playing around with statistical significance. It was Ronald Fisher who actually formalized the whole framework into frequentist framework, and then we also have the p-values as a product for that. So in 1920, maybe that period, it was the Pearson who actually formalized the p-values, which were still, by the way, using 100 plus years today and are even the core of the clinical trials and regulatory decision processes and everything. So I'm not sure about the medals, but I think recognition is very, very significant for the statistical part for Ronald Fisher, I'd say.
Okay, right. Right. We should get a little frame on the wall there. Um, okay. So, and after that, that's it. Math did not evolve after that. I remember the Bayesian came back, but on the frequentist side, there haven't been. Is there a variation on a different way of calculating the p-value, or no? I mean, the math is settled, and we don't need new math, and that's it. We know how to do to use that tool.
I think that's a very good point, Bruno. And a lot of people actually confuse this and they consider the p value to be like a universal concept. So, what you just said actually reveals a big gap in the knowledge of many people don't consider what you just said, which is that the p value can be calculated using so many different ways. So, there are actually 850, maybe even 1,000 plus uh, different hypothesis tests. In majority of them, we actually use a different formula to calculate the p-value. So each different formula means that we are making different approaches, different statistical assumptions. Some of those tests test means, some medians, some test something else, some test the survival curves, as we have in oncology, very abundant tests for survival curves. So the p-value is actually not a universal concept. It's related to what we are testing. So we could be testing one thing, we could be testing something completely different formula. The p-value is more like, in my opinion, the p-value is more like a definition of philosophy. So the philosophy is, well, I see a specific result. Would I see at least as extreme result if I was to repeat this study over and over again? And what kind of confidence can I have in my result? I like to use term trustworthiness for the p-values. So the p-values tells me, okay, I have a specific result. How much trustworthiness can I have in my result? That's like the easiest way for anyone to reason about the p-values. But the p-values may not be enough, right? The p-values have been misused for a very long period of time, and people were using just p-values to say, hey, I have a positive result. The p-values are just tell you, hey, can I trust this result? Now, the results can be positive or negative. It could be, oh, we have beautiful animals here. My favorite animals, cats. Two Bayesian and the frequentist cat. So, you know, so I guess, the cats also have their own team, I guess. And, going back to what I was saying before, we have a term called clinical meaningfulness. So is the result, so that's what everyone from our audience who is reading clinical trials will often see. This result is clinically meaningful and statistically significant, or is it's not clinically meaningful and statistically significant. So clinically meaningful means that the magnitude of the effect is large enough to consider it, hey, this is clinically going to change things in this area. And the statistical significance is the other part of the story, which tells us, well, the result you just seen, that magnitude you just seen, that difference you've just seen, how much can we really trust that? You know, if you were to reproduce the study, is it trustworthy? Now, I know these concepts may be like counterintuitive sometimes, especially as we have different angles. But I think when you combine these two together, like clinically meaningful, statistically significant, then only together they form something that can be used for a decision process and, you know, statistical analysis in full. What's your thought on that?
I want to see again the meme.
Oh,
I know you just a second. It's too so funny. Okay, too slow for me, but I'll read that one
oh, yeah.
later.
I mean, this is probably, you know, a meme that tells that, you know, it's the Bayesians use a lot flexibility, let's say, in their analysis. But as I always like to say, you know, even though there are angles that you could criticize, there are also angles that are useful in Bayesian analysis. So I always mention that there
Yes,
are fields like quantum physics where, you know, you just Bayesian approach is one that can model some things that are kind of weird for the frequentist way of reasoning. So there are these exceptionally specific situations where you cannot count on repeating anything many times. I mean, you don't have to repeat it, but even in theory, it's difficult to to have philosophy about repeating something. Like, you know, electrons in the atom. It's very difficult to reason how many times will electron be here. Well, electron can be at multiple places, actually measured at the same time, or even these subatomic particles. So I won't go into quantum physics, of course. I just wanted to mention that, you know, Bayesian statistics, it has specific use cases, even though that, you know, we are discussing all these memes and everything. So, you know, a long story short, I think that you know, it's important to go back in time and understand where it all came from. So Pearson, Ronald Fisher, they kind of introduced this concept that is so powerful that it survived more than a century, and we are still using it as a core of today's statistics.
what is MMM?
Yeah, the MMM could be actually many things. So it could be mixed marketing models. So I discuss this often with my friend Venkat, if he's watching. Special hi to Venkat. And there are other mixed models in statistics. Usually it's something with the mixed models. So there is this family of models, let's call it that way, that uses mixed modeling. And I think this is probably marketing mixed modeling. The MMM.
I know Shahir, executive producer, is going to be mad at me. I'm getting off topic on p-value, but not completely. I'm relapsing into being anti-Bayesian. The meme, now we shouldn't rely too much on meme, but memes mean a lot, right? So I continue to think that frequency is one, period. They are the practical, useful, recognized way to get a drug approved. You cannot get a drug approved with Bayesian stats. I think that's clear. You can do, I don't know, market access site studies, right? Like NMA maybe, and other things on the side, but you cannot get a drug approved with Bayesian statistics. And so who cares about Bayesian then? It's academic.
I have a point on that. I respect your take. I'm not saying you should not be against or should not be on the frequentist side, but I'm saying there should be a fair debate, and you should be able to convince the Bayesian audience that's watching us.
Oh, but
There's
no,
there's
no. I mean, yes, but no, because I say, okay, fine, Bayesian, you're right, but it doesn't matter. Let's assume your math is better. Fine. Okay, your math is better. It doesn't matter because in the concrete world, if you want to get a drug approved, you have to do frequentist analysis. It's like Betamax versus VHS, right? Betamax was better, fine, but VHS won. So practically speaking, in the world, if you want a drug approved, forget Bayesian mathematics.
it's a
No?
total failure on that side.
It's a what?
It's a total failure. No use the Bayesian methods.
Well, it seems academics to me, right? Because the FDA is going to require frequentist data.
Let me announce something. I'm looking for a Bayesian positive person to debate with Bruno and Darko for maybe the next, or for an episode that we can align this month, and we can make this really interesting because we already have plenty of people looking at us, including our friend Paul Swenson. Appreciate all of you tuning in, and I'm trying to find somebody, and then we'll try to arrange a good bit of a debate on this. I'll go
Extreme
off.
sports.
But yeah.
Well, on that note, any final points before we end this episode today, Darko?
Yeah, so I think the final point could be that, we are always sending love to the Bayesians, even though we may have different opinions.
Yes.
And I always like to say there are fields where Bayesian statistics is used. Even artificial intelligence is one of them, which is one of our favorite topics. So I'd say the p-value is interesting to go back in time and see how much they survived. So they survived to this day. Some people actually want to ban them, but they still survive. So the p-values are a very important concept, and I'm glad that we kind of highlighted that in this podcast.
Yes. Thank you, Darko. Happy New Year. Au revoir.
Au revoir. Happy